Good evening, my dear friends. Dr. Azam here, Faculty of Anatomy at Unacademy platform. Now, let us continue with our discussion on joints. Let me just check here whether, yeah, perfect. I hope I'm visible and audible to all of you here. Yeah, perfect. Now, welcome back, guys. Yesterday, we have started with the discussion on the types of joints. I told you this is like one of the most important topic, types of joints for each and every entrance exam that you're giving. And just to recall, like yesterday's class, there are totally like 3 types of joints. We have seen that yesterday. Number 1, you'll be having the types of joints. There are totally 3 types of joints. Number 1, the immovable joint will be your fibrous joint, fibrous variety. And number 2, the partly movable joint will be the cartilaginous joint. And then the completely movable joint will be your synovial joint, guys. Completely movable joint will be the synovial joint. And yesterday we have discussed in detail the immovable joint, that is a fibrous variety, the fibrous type of joint. It's again subdivided into 3 varieties. That is number 1, between the cranial bones, that is sutures. And then between the tooth and the socket, gomphosis, and then syndesmosis. I give you the example as middle radial ulnar joint and the inferior tibiofibular joint and sacroiliac joints and all. On the other side, cartilaginous joint, we studied the primary and the secondary cartilaginous joint, and I gave you all the examples of the primary and secondary and all those things. And now today our topic is mainly about the synovial joints. Synovial is actually the freely movable joint. See, we'll do one thing here. We'll learn the synovial joint in a little bit, in a different manner, guys, in a retrograde manner. What is happening, every time I'm observing one thing in our live classes and all, synovial joints, there are like variety of them. The ball and socket joint, hinge joint, the plane, pivoid, ellipsoid condylar and all. So all the students are finding it like literally hard, very tough to remember all the examples. So what I have done is, I'll show you like 4 diagrams, one diagram of the complete upper limb and one diagram of the complete lower limb. And then we'll discuss one diagram with the thoracic wall region, and then miscellaneous about the ear ossicles and all. So with the help of these 4 or 5 diagrams, we'll become perfect with all the examples, and that too in a conceptual manner. And then at last, we'll concise all these joints at one place. Okay? So we'll do one thing, we'll learn in actually a ulta manner, retrograde manner. Let's go towards all these joints in the upper limb. So I'll deal with all the joints in upper limb like in a step-by-step manner. First of all, clavicle here. So we'll be having like sternoclavicular joint here, and then this one will be acromioclavicular joint here right now. And after that, the next one will be shoulder, then elbow, then radio-ulnar, then the wrist, then we'll see further blah blah. Okay. So now in this diagram here, you can clearly see that here this is the clavicle here right now, guys, and the clavicle will be joining here with the sternum on the medial side here right now, mandibular sternum. So obviously, what will be the name of this joint here right now? This will be the sternoclavicular joint. So let me do one thing here. First of all, let me write down the names of all these joints. So what is the joint here right now? This one will be the sternoclavicular joint. Okay. Now after that, this joint here will be the acromioclavicular joint. Sternoclavicular joint, then we'll be having the acromioclavicular joint. Clavicle joining with the acromion process. And after that, no doubt about that, this joint here will be the shoulder joint here. Okay. And the shoulder joint is between the glenoid cavity of the scapula, therefore gleno, and head of the humerus, therefore humeral. It is also known as glenohumeral joint. The shoulder joint is also known as glenohumeral joint. And the next joint here, this will be your elbow joint here right now. Okay. Now after that elbow joint here right now, you can clearly see this is the radius and ulna here, and between this radius and ulna there will be a radio-ulnar joint. Radio-ulnar joint. Okay. And this radio-ulnar joint will be in turn of three types, guys. There will be one superior radio-ulnar joint here, and there will be a middle radio-ulnar joint here right now, and there will be an inferior radio-ulnar joint here right now. So remember, the radio-ulnar joint will be in turn of 3 varieties here right now. There will be one superior, there will be a middle radio-ulnar joint, and then there will be an inferior radio-ulnar joint. Then after that, you can clearly see this is the radius bone here. This radius bone is joining with the carpal bones here right now, guys. This is the radiocarpal joint. Yes, very famously your wrist joint. So wrist joint, I can give it one more name here right now. It is also known as the radiocarpal joint. Fine. And after that, you are able to see this joint here right now. This one will be the carpo-metacarpal joint. Carpo-metacarpal joint. And then this one will be the metacarpophalangeal joint. I'll just write down in short here right now. And then you'll be having the interphalangeal joint, guys. So I'm pretty confident you already know the names of all these joints. Now the best way to approach here, it will help you in, in learning the types and subtypes of the joint in a very conceptual manner, easy manner. Instead of just, writing the type like ball and socket and just writing the examples there and just mugging up. I don't like that. Let us learn in a conceptual manner. So my students are already perfect, expert in all the names of all the joints in a sequential manner. And now, my dear friends, let us write down their type and subtype. Or better, we'll do one thing here. We'll write down only the subtype. Why? Why? Because type you already know. Yes, all these joints are nothing but which type of joints, guys? These are all nothing but the synovial type of joint. So why to write down that synovial type again and again as synovial? Type already हमको पता है. All of them are movable. All of them are movable. That's why everything is nothing but synovial. Now let us just write down only the subtype right now, guys. Now in this subtype, remember first of all the sternoclavicular joint here right now. This joint, sternoclavicular joint. This is of saddle variety. It's saddle joint. Okay, it's saddle joint here right now. I think on your screen there you're not able to see on the right side there. Just write down, okay, saddle joint there, sternoclavicular joint. So why the name is given as saddle? Try to learn with the meaning there. Actually, the word saddle, I think you have seen when a person is riding on the horse, he'll be sitting on the back of the horse and he'll be sitting on that the structure that is nothing but saddle only. And that is the reason why the name of the joint is given the name as saddle joint. Why? Because it will be like concave or convex. It will be having like concave or convex surface. That is why saddle joint. Fine. So it is based on the shape of the joint. Next one, acromioclavicular joint. This is of the plane variety, guys. It's a plane joint. Okay. So we are just going to write only the subtypes. We are not writing the type. Why? Because all of them are movable. All of them are synovial variety. Acromioclavicular joint is plane variety. Next one is shoulder. Shoulder joint. I think I don't even have to tell you. It's ball and socket joint. Our favorite. No one can stop you from saying that joint. That's ball and socket joint, shoulder joint. And then the next one, elbow joint. Elbow joint is of hinge variety, hinge joint. Till here, each and every student will manage. But the confusion is starting in the radial nerve joint. I'm seeing in most of the classes, students are confused with radial nerve joint. First confusion, in many of the classes, students don't even know. Okay, there'll be 3 radial nerve joint. I don't know what. During the MBBS days, what is happening? They're just teaching like superior and inferior. There are only 2 radial nerve joint. Absolutely not, sir. First point, learn that there are 3 of them: superior, middle, and inferior radial nerve joint. First point. The second point, the superior and the inferior radial nerve joint is movable. It's of synovial variety. It's movable, synovial. Acha, if it is movable, which kind of movement is possible there? Yes, pronation and supination. Pronation and supination. That means ulna bone will remain there itself and this radius bone will, yes, take a turn over that. And we all know that whenever in our body one bone is at its place, the another bone is taking a turn around that. That's a pivoid type of joint. I repeat again, ulna will remain there only and the radius will take a turn over that. So therefore superior and the inferior radial nerve joint will be of which variety? Pivoid variety. So therefore the superior radial nerve joint will be a pivoid joint and the inferior radial nerve joint will be a pivoid joint. And now, my dear friends, if you remember my yesterday's class, already I told you this example in my yesterday's class that middle radio-ulnar joint is one of the best examples of your syndesmosis. Clear? And syndesmosis is of belonging to like which type, guys? Fibrous, the immovable type of joint, or which is permitting a slight movement. So I'm just writing it with a different color there, the blue color there. Why? Because it doesn't belongs to the category of synovial or the movable type of joint. It's immovable category of joint. Next one, guys, wrist joint. Wrist joint or the radiocarpal joint will be, yes, the ellipsoid joint. Carpo-metacarpal joint here will be the saddle joint. And then finally metacarpophalangeal joint will also be like ellipsoid variety, guys. It's of ellipsoid joint there. Fine. And then the interphalangeal joint, yes, without any doubt, the interphalangeal joint will be nothing but your, yes, the hinge variety. It's also allowing, you know, the flexion and extension of that one. So interphalangeal joint is actually a hinge joint. Okay. So functionally it's also included in plane variety, but better, you know, the hinge joint there. So in this way, if you write down, if you see there, almost 60 to 70% of joints you already know there, you know, ball and socket, the hinge and all those things. Whichever you don't know, just, you know, concentrate on that one and you're perfectly done. Fine here. So let us just review once more here right now, guys. The sternoclavicular joint will be saddle variety. Acromioclavicular joint will be plain. Shoulder joint is ball and socket. Then the elbow joint will be the hinge variety, hinge joint. Radioulnar joint, yes, the superior and inferior will be the pivoid variety, and the middle radioulnar joint will be syndesmosis, okay, fibrous variety. And then this joint here, the wrist joint will be ellipsoid, and then carpometacarpal joint will be saddle, and again this will be ellipsoid, metacarpophalangeal, and then this will be again hinge joint, guys. That's about your upper limb. Now we'll come to the lower limb right now. Now in the lower limb here, yes, first of all let us write down quickly the names of these joints here right now, guys. Now this joint here will be your hip joint here right now, and this joint here will be the knee joint here right now. Okay? And now I want you all to learn one thing here. Near the knee joint here right now, I'm having one bone, that is your femur here. Okay, and then below here there will be tibia, and this is the fibula here, and this is the patella here. Remember, fibula is not involved in the knee joint. So therefore the knee joint is between, one joint is between the femur and tibia, and another joint is between the femur and patella. Okay? So knee joint, one joint is between the femur and tibia, another joint is between the femur and patella. I'll come back to that, don't worry about that. Now the next joint here, this one is the tibia here, and this one is the fibula here. So therefore that will be your tibiofibular joint. Tibiofibular joint. And this tibiofibular joint, I can clearly see that there will be one superior and there will be one inferior tibiofibular joint. So again we can divide that into two categories. One will be superior, another one will be the inferior tibiofibular joint. And the next joint here, this one will be the ankle joint here right now, guys. And the next joint here, again the same thing, guys, the tarsal, you know, metatarsals, and then the phalanges, the interphalangeal joint. So therefore the metatarsophalangeal joint, and then you'll be having the interphalangeal joint. Interphalangeal joint here right now. Now again we'll do the same thing. Type will be obviously mobile synovial. So we'll not write the type there. We'll just write on the subtypes here right now. Hip joint, I don't have to teach you. Yes, it is of which variety? Which subtype, guys? Ball and socket joint. Hip joint will be ball and socket variety. And after that the knee joint here right now. At the knee joint, please be very careful here. We have to learn in depth here right now. Between the femur and tibia, I can clearly see, yes, the condyles there. So therefore, because they are actually formed by the condyles there, femur and tibia, this will be condylar joint. And between the femur and patella, that will be a saddle variety, guys, saddle joint. Okay? Femur and patella, that is a saddle joint structurally. In some of the books, this is also included under plane variety also. It is also included under plane joint also. But remember, that is functionally. But yeah, most of the time, whatever joints we'll be seeing, it is based on the structure itself. So if both options are given, plane and saddle, better option will be the saddle joint. Is it okay? So between femur and patella, it's of saddle variety. Now tibiofibular, yes, superior tibiofibular will be actually the plane variety, plane joint. Whereas the inferior tibiofibular, yesterday I told you about this one also. Yes, this is also another example of, yes, syndesmosis. Syndesmosis. And that belongs to which category, guys? The fibrous joint. So remaining all are mobile joint. This is like, you know, type of immobile joint, the fibrous joint. Now again, welcome back to this ankle joint here. Ankle joint is of which variety, guys? Hinge joint here. And metatarsophalangeal, same like metacarpophalangeal joint, same like that. It is nothing but again ellipsoid variety. So it becomes easier if you learn in this manner, ellipsoid joint. And interphalangeal will be again of hinge variety, the hinge joint, guys. So it makes things easier for us if you learn it conceptually. Again, the same thing, if you observe 60 to 70% of joints you already know there. Whatever joints you don't know there, just try to learn about them. That will be done. And now once you are done with this upper limb and the lower limb, and now please welcome to the one of the joint in the lower limb where most of the students will be getting confused here right now. Listen here. The moment I say ball and socket joint, each and every student, even average MBBS student, yes, number one example comes in the mind, shoulder joint. Number two example comes in the mind is hip joint. Please don't even learn that, they will never ask you such easy types of question. There are two more other ball and socket joints in our body. Where are they located? Let me show you. In this diagram, you are clearly able to see this heel bone here. This is your calcaneus here, right? And above this bone here is nothing but your talus here right now. And in front of the talus, there will be a boat shaped, and that will be the navicular. So this is your navicular bone here right now. And there is a joint between these three bones. The name, beautiful, and it is like easy name here right now. Just read the names of all the three bones in clockwise direction. Talo, calcaneo, navicular. First learn the name, aram se. Okay now. So talo, calcaneo, navicular. What is the name of the joint? Talo, calcaneo, navicular. Some students I am seeing in the live classes, that means face-to-face classes, they are finding it difficult to even learn the name, how to memorize the name. Just read them in clockwise direction. Talo, calcaneo, navicular joint. And now this is like which variety of joint or which type of joint, guys? Talo, calcaneo, navicular joint. This talus above here is acting like a ball, and that is actually fitting into the socket made by navicular and the calcaneum. So talo, calcaneo, navicular joint, this is actually another example of ball and socket joint, and this is what is not striking us during the exam. Every time the moment I say ball and socket joint, what comes in mind? Shoulder joint, hip joint. Forget about that. They will never ask you the easy types of joints in the exam. Yes, concentrate on this one. So from today onwards, you're going to remember this joint. Talo, calcaneo, navicular joint is an example of ball and socket joint. Let us go to the next variety. So I'm done with two diagrams, upper limb diagram and the lower limb diagram. Almost all the joints are done. Now welcome to the thoracic wall. In thoracic wall, if you remember my yesterday's class, costochondral. Come on guys, try to recall. Costochondral joint, this one will be the primary cartilaginous joint. All the costochondral joints will be primary cartilaginous variety. Now today let me teach you about the joint between the cartilage and the sternum. Even yesterday some of them was asking in the comment section, sir, what about the joint between the sternum and this cartilage here? Yes, this is cartilage, right? So what is the name of the joint? Chondro, and it is between the sternum, chondrosternal joint. Okay, chondrosternal joint. So all your chondrosternal joint, this one will be movable, and that too, they belongs to which category? The plane joint. So all the chondrosternal joints will be of plane variety, synovial type. And what is the subtype in that? It is of plane variety. I'm telling you a little bit slowly here, why? Because many students are getting confused here. थोड़ा सा आराम से करते हैं. So chondrosternal joints will be of plane variety, synovial. But what about the first chondrosternal joint? It's given wrongly in many MCQ guides and all those things. One of the updated thing in the 41st edition of Gray's Anatomy is the first chondrosternal joint. The first chondrosternal joint, it's unusual variety of the fibrous joint, guys. It's given very clearly in the 41st edition of Gray's Anatomy. It's unusual variety of the fibrous joint. I'm reading the exact words from the book. Understanding here? So between the ribs and the cartilage, costochondral joint, that is a primary cartilaginous joint. That is not at all our topic today. We have already discussed that yesterday itself. Forget about that. Welcome to our today's topic, synovial joint. In synovial joint, the plane variety, all your chondrosternal joint. Chondrosternal joint will be plane variety, except for the first chondrosternal joint, that is of unusual variety of fibrous joint. Done. That is about this joint here right now. Let us turn this behind. Once you turn this behind here right now, guys, yes, what is the joint between the rib here along with the vertebrae? And this will be the costovertebral joint. And remember again, this costovertebral joint is also belonging to which variety only, guys? The plane joint only. Wow. That means just try to remember simply, in this thoracic wall here, almost all the joints are actually the plane variety only. So costovertebral plane, chondrosternal all plane only, except the first chondrosternal joint, that is a fibrous, and the costochondral joint will be the primary cartilaginous joint. So that's what I'm telling you. Try to remember in my way. I think this will be beneficial to you. Just practice once or twice, it will be done. One diagram upper limb, one diagram lower limb, and one diagram the thoracic cage. This is done here right now. And now welcome to the last and final thing right now. In the ear ossicles, you'll be having like malleus, incus and stapes. This is also like synovial variety, movable type of joints. Oh my god. One joint is between the malleus and the incus, incudo-malleolar joint. Okay. And there's one more joint between incus and stapes here right now, and that will be incudo-stapedial joint. Now out of these two, remember incudo-stapedial joint, another example of ball and socket joint. Oh my god. So from today onwards, all my students are going to remember ball and socket joints. There are 4 examples in our body. Number 1, shoulder, forget about that. Number 2, hip joint, forget about that. Number 3, remember, yes, talocalcaneonavicular joint. And number 4, remember very well, incudo-stapedial, between the incus and the stapes, ball and socket joint. And what about the incudo-malleolar joint, guys? Yes, incudo-malleolar joint will be another example of your saddle variety, the saddle joint. Okay, so please learn in my way from today onwards. If you just remember with these 4 diagrams, I think your life will be easy in the synovial joint category, guys. Okay, so now we'll do one thing here. Achha, one more thing, last and final thing, sir. Sorry. Yes, about the base of the skull there. I think most of the students will be knowing this one already, guys. Between the atlas and the axis, atlanto-axial joint here. Between the atlas and the axis here right now, atlanto-axial joint, that will be like, you know, the atlas bone and the axis bone is rotating around there. I told you already, that is which type of joint, guys? Pivot joint. Pivot joint is atlanto-axial joint will be pivot joint. Atlanto-axial joint will be pivot variety. Whereas what about this atlas bone and the occipital bone here right now, sir? I mean to say this one, atlanto-occipital joint. That is an example of your ellipsoid variety. Atlanto-occipital joint will be ellipsoid variety. So I repeat again, atlanto-axial joint between the atlas and the axis. Okay, and that is actually the pivot variety. And atlanto-occipital joint, that will be of ellipsoid variety, guys. That's all. If you remember like this, more than enough. Okay. So now what we'll do here is that, okay, we'll make a list of all these joints at one place right now. After completing all the joints here right now, let us make a list of all the joints at one place, the way that you have actually studied in your MBBS days. Is it okay? So just keep on making the list along with me. Heading Lico, write on the heading there as synovial joint. Let me just repeat for the last and final time right now, guys. Last and final time. Types of joints, 3 types from today onwards. Immovable, fibrous, completed yesterday. Partially movable, cartilaginous, completed yesterday. And now today, the movable joint is synovial joints. In synovial joint, what are the subtypes? Number 1, there will be ball and socket joint. Whatever I have taught you in the last 20-25 minutes, try to recall at one place. What are the examples of ball and socket joint? Number 1 example, shoulder joint. Number 2 example will be the hip joint. Number 3 example, talocalcaneonavicular. Talocalcaneonavicular joint. And the number 4, remember about the incudo-stapedial joint. And I would like my students to concentrate on these 2 joints, guys. This is what you will be tend to forget in your exams. Okay. After that, number 2, remember about the hinge variety, the hinge joint. Now, what are the examples of hinge joint here? Yes, we all know elbow joint. No need to learn that. We all know ankle joint. No need to learn that. Any point of time you can tell that. Fine. And we already know the hinge joint. One more will be your interphalangeal. Interphalangeal joint will be the hinge variety. Hinge joint. I think this is like easy one. Any point of time, any given point of time, you can clearly answer this one, guys. Next one, should I erase this? Now welcome to the third category here. Third subtype here, the condylar joint. Condylar joint example already I told you in the knee joint, guys. And that too, in the knee joint, the condylar joint is between what? Femur and tibia. Between the femur and the tibia. And not only that, one more important one which I did not tell you till now, that is your TMJ, temporomandibular joint. Yes. Temporomandibular joint is another, yes, very good example of your condylar joint, guys. Remember this one here. Number 4, remember ellipsoid joints. Just try to recall whatever I taught you in the last 20-25 minutes. Just consider that one place. What are the examples of the ellipsoid joint? I told you already. Metacarpophalangeal joint. Okay. Similar to that one will be metatarsophalangeal joint. Okay. And I told you even the wrist joint here right now. Wrist joint. So wrist joint here and the metacarpophalangeal joint here, and similar to that one, metatarsophalangeal joint. And just now I told you the last one, that is atlanto-occipital. Atlanto-occipital joint, between the atlas and the occipital bone there. Atlanto-occipital joint is another example of ellipsoid joint, guys. Done here right now. That's what I'm trying to say you. See, that's what is a mistake that we have done in our MBBS days. In first year MBBS days, joints topic, okay, now a great or a big confusion. Why? We are learning in this manner. We are writing the name of the joint and all the examples. One example is from the upper limb, one other example from the lower limb, one example is atlanto-occipital here, and a lot of confusion. So better do one thing, 4 diagrams. Okay. If you want, I can just forward you that PDF of that one. Just keep that with you and take a Xerox copy of that and you just practice that. That 4 diagrams you practice. Conceptually you are learning that without just simply mugging in this one here. I don't like this method actually. Just for the sake of writing the notes, we are completing this one, guys. And right on the 5th category there one, saddle joint. Now look at this now. Examples of saddle joint. One joint will be in one corner, the other joint will be in another corner. Saddle joint we have learned first of all in the ear ossicles between the incus and the malleus. So therefore it will be incudo-malleolar joint. Okay. Number 2 saddle joint I told you here between the clavicle and the sternum. That is the sternoclavicular joint. Sternoclavicular joint. Okay. And number 3 I told you about this one here right now. Wrist joint is ellipsoidal. Metacarpophalangeal joint is ellipsoidal. What about the carpo-metacarpal joint? Carpo-metacarpal joint, that is saddle variety. Carpo-metacarpal joint will be of which variety, guys? Saddle variety. One more, knee joint. And near the knee joint, which one? The joint between the femur and patella. Femur and tibia is condylar variety, already we wrote. Femur and patella will be actually the saddle joint here right now. And one more thing, if you want to remember, the joint between the calcaneum and the cuboid, calcaneo-cuboid joint is of saddle variety. Again, the same thing I would like to say. Look at those examples. One example at one place, another example at another place. Better way, learn it conceptually. Okay. Now, once you are done with the saddle joint, the next one that is left out, I think we are left out of the plain variety. Let me remove this. Right on the heading there. Next one will be the plain joint. Yes. Okay. Now, what are the examples of the plain joint? Already we know. Chondrosternal joint. All your chondrosternal joint, and I told you very clearly, except the first chondrosternal joint, given very clearly in the 41st edition of Gray's Anatomy. It is a unusual type of the fibrous joint, except the first one. And then the costovertebral joint. Costovertebral joint. Okay. And then the acromioclavicular joint. Acromioclavicular joint, yes, it's also the plain variety there. And then the superior tibiofibular joint. Superior tibiofibular joint that we have seen in the lower limbal part. Is it okay? And I think we are left out with the last and final one, that is a pivoid joint. And pivoid joint examples already you know. One is between the atlas and the axis, that is atlanto-axial joint. Okay. And one more pivot joint that will be the superior and inferior radio ulnar joint. Okay. So that's about your synovial joint. So in most of the classes, most of the students are learning in a wrong way. So don't learn in that manner, guys. Okay. They are writing all this, the 7 subtypes of synovial joint and just mugging up the examples. Always there will be a lot of confusion in that. Don't do that. The best way of learning all these joints will be, first learn with the help of that 4 diagrams, and then just make a list of that, and that will be completed, sir. That is done with the joints. So I think these sessions on the YouTube that we have done yesterday and today, 30 minutes yesterday, 30 minutes today, all the types and subtypes of the joints is very much helpful to you. The fibrous, cartilaginous and synovial type. And please, hardly it will take 5-10 minutes of time to revise that, learn that, make a list of that, write it on a piece of paper, and stick that paper wherever you're learning in your, the study room or near your table where you're studying that, because it's one of the most important topic. Every now and then it will be tested about the type of joint and subtype, and it is like easy mark, actually easy 1 mark you can get in that. So I think this has helped you. And remaining classes and concepts already going on the Unacademy platform. You can see we're coming up with the integrated course and all. So please try to join there, and we'll study the remaining concepts in detail. Hope this has helped you, and hope I have helped you how to learn the types of joints in the easiest manner possible. Okay. See you again. Take care. Bye bye. Good night.